I'm Dr. Ali. Welcome back. For those of you who are joining us for the first time, please subscribe to continue to be part of this healing community where we share knowledge and research that we need to heal and sustain good health. I'm a functional physician and a mindfulness coach. My goal is to provide education and guidance to our patients, their families, as well as our community on how to achieve optimal health and wellness. Everyone has the ability to achieve optimal health by making simple, sustainable changes to our lifestyle. We can prevent and even reverse chronic disease. With that, let's talk about the topic that we will be discussing today. Today, we are talking about perimenopause and how do we navigate it for optimal wellness. So let's start by talking about the definition of perimenopause. So perimenopause refers to the time period that leads up to menopause. Menopause is the stage when menstrual periods permanently stop. The transition to menopause can take several years and is characterized by changes in the menstrual cycle as well as physical and emotional symptoms resulting from changes in the body's production of hormones, estrogen and progesterone. The duration of perimenopause can vary from person to person, but it typically begins in the late 40s and lasts until menopause. In the last 1 to 2 years of perimenopause, the drop in estrogen speeds up, and many women start to experience menopausal symptoms. So let's talk about what are the symptoms of perimenopause. So one of the most common symptoms associated with perimenopause is changes in the menstrual cycle. So you could find that the periods may be longer or shorter, the bleeding may be lighter or heavier, and there may be random times where the period skips a month or more. The second important symptom is hot flashes and night sweats. These are sudden feelings of heat that cause a flushed appearance in the face and upper body and can result in significant sweating and discomfort. Night sweats can certainly disrupt sleep. In addition to night sweats being disruptive to sleep, women undergoing perimenopause may also experience sleep disturbances, such as difficulty falling asleep or staying asleep. These women can also experience mood changes such as irritability, anxiety, and depression, as well as vaginal changes. So the decrease in estrogen leads to the vaginal tissue losing its lubrication and elasticity, leading to dryness, discomfort, itching, or pain during sexual intercourse. In addition to that, these women can also have urinary problems such as the need to urinate more frequently or urinary leakage or incontinence. Some women may also develop more frequent urinary tract infections. Women may also feel that their breasts become tender or become less full during this period, and they will also experience a change in the sexual desire or arousal. Of course, another aspect of a reduction in estrogen is bone loss, which increases the risk of osteoporosis and fractures in women going through perimenopause. So, what is the importance of perimenopause in a woman's life? So, we know that perimenopause is a stage of transition. It's a transition in which the body is trying to shift its course. The body has made a wise decision to conserve the energy and resources by shutting down the ovaries because we are no longer going to be having kids. So the idea is that the energy and resources can actually be used for other activities and functions in the body. The reduction in the production of estrogen and progesterone leads to a lot of different changes in the body. It's a time where the body is making us aware that it is going through a period of change, which would mean that its requirements for nutrients, its requirements for care are going to be different. So, this is an opportunity for women to be able to look at what are the needs of their physical and emotional health at the point in time when they enter the stage of perimenopause. It's time to look into long term health goals and how to sustain optimal functioning of the body. So, let's talk about the hormonal changes that occur during perimenopause. So the two primary hormones that are primarily affected are estrogen and progesterone. So we find that there is a reduction in estrogen production. However, this decrease is not linear, and estrogen can fluctuate wildly, sometimes even peaking to higher than usual levels. And then the progesterone levels will also go down. And so these changes are what cause the physical, emotional changes that we see in these women. Another very important area of change is the change in body composition. So, what we find is that during perimenopause, there is a tendency to have an increase in central body fat distribution, which simply means that there is an increase in abdominal fat or visceral fat, which is the fat surrounding the abdominal organs. And this fat is very active metabolically. It releases a lot of inflammatory markers. And as a result, it increases the risk of heart disease. So we know that women who are perimenopausal may notice changes in their cholesterol levels due to declining estrogen. They may also have an increased risk of metabolic syndrome. Metabolic syndrome is a combination of conditions like high blood pressure, high blood sugar, excess belly fat, abnormal cholesterol, and triglyceride levels. Metabolic syndrome increases the risk of heart disease, stroke, insulin resistance, and type 2 diabetes. We also know that these women may also have higher levels of certain markers of inflammation, which can increase the risk for heart disease. This could be due in part to the loss of the protective effects of estrogen. So, the common issues related to sleep is obviously night sweats that we have talked about. But there is also the possibility of having other sleep disturbances. There is also the possibility of developing sleep apnea, which is basically disordered breathing during sleep as a result of increase in fat in the belly. There is also high likelihood of developing restless leg syndrome, night sweats, as well as a lot of different mood changes such as irritability, um, mood swings, depression, anxiety. So the question is that what are some of the solutions to have a smooth transition? And how do we navigate perimenopause? So the first and foremost thing that we all need to focus on, if this is something that concerns us, is a hormone balancing diet. So hormone balancing diet is a diet which is rich in phytoestrogens. Phytoestrogens are foods that contain phyto, meaning plant derived estrogens. They are plant-based compounds that mimic the effects of estrogen in the body to help balance hormonal levels. Remember that these phytoestrogens are not as powerful as the estrogen that we produce in our body. However, they're extremely helpful in balancing hormones. So the foods which contain phytoestrogens include flax seeds, sesame seeds, and certain fruits and vegetables. The other thing which is very important is to add healthy fats, such as those found in avocados, nuts, seeds, and olive oil. Because we know that healthy fats support hormone production and reduce inflammation, which can exacerbate the symptoms of perimenopause. The second thing which can be very helpful is mindfulness coaching. As we have mentioned before, that perimenopause is a time when women experience sleep disturbances. It's a time when there is issues pertaining to emotional regulation, such as mood swings, anxiety, and depression. It's also a time when women may experience increased physical discomfort or pain, such as headaches and joint pain. So, mindfulness coaching is extremely helpful to help a woman deal with the stressors that she is trying to cope with, as well as the symptoms related to the transition of perimenopause. It helps you become more aware of your emotional state and provides tools to manage intense emotions. It can also provide the techniques that we need to help manage the pain in a better way. Most importantly, it has the ability to improve the quality of life by improving sleep, helping us regulate our emotions, and dealing with physical discomfort. The third important area is detoxification. This area is very important because we know that many of the toxins can act as xenoestrogens, meaning they can act as foreign estrogens, leading to a lot of hormonal imbalance. And this becomes even more pronounced during perimenopause. And so the process of detoxification is very helpful because it allows the body to get rid of some of those toxins, which would reduce the intensity of the perimenopausal symptoms. We also know that the liver plays a crucial role in detoxifying the body and also in metabolizing hormones. So, a detoxification program helps support the liver, which in turn help balance the hormonal levels. Similarly, detoxification also reduces inflammation, and we know that inflammation exacerbates perimenopausal symptoms. Similarly, detoxification programs also significantly help reduce the weight. And the reduction in weight would reduce the abdominal fat and thus reduce the risk of heart disease, stroke, and diabetes. The fourth thing is that there are certain supplements which can help balance our hormones. And these supplements, depending on the history of the patient, can actually be very helpful in terms of um, managing the symptoms of perimenopause. So, those supplements can be used to help balance the hormones in the body. In women where the supplements have not been very successful, bioidentical hormones can be used. Bioidentical means the hormones are chemically identical to those in our body. So, one of the things is very important to understand that bioidentical hormones are not the first line of helping perimenopause. They are used as a last resort because anytime we add external hormones, they will have side effects and they will impact a lot of other organs in our body. So it is very important that first of all, we measure hormones before we give any hormones to a patient. And once we start giving hormones, we have to recheck the levels to make sure we know what the levels of the hormones are. We know that um, the hormones estrogen and progesterone can affect reproductive cancers, and hence we do not use them as the first line. Rather, we use the supplements. But if we find that the levels are really low, which is impeding the supplements from achieving their results, then we can go into bioidentical hormones. Vaginal health preservation is very important. And we know that a lot of women experience vaginal thinning and dryness, often referred to as vaginal atrophy. These changes cause discomfort and pain during intercourse, as well as increased risk of urinary and vaginal infection. And so there are many ways to actually prevent and treat vaginal dryness. We have both hormonal and non hormonal therapies which are applied directly to the vagina with excellent results. We also know that regular sexual activity can also help maintain blood circulation to the vagina, which can help keep the tissues healthy and supple. Another very important area that we need to focus on if we are going through perimenopause is pelvic floor strengthening. There are multiple reasons why pelvic floor strengthening is very important. The first being that if we have strong pelvic muscles, it will prevent incontinence, which is one of the issues faced by women in the perimenopause and menopausal times of their life. The second thing is that the pelvic floor muscles play a very important role in sexual function, and strengthening them can enhance sexual sensation and orgasmic function. We also know that pelvic organs, such as the bladder, uterus, and rectum, are supported by the pelvic floor muscles. So, strengthening these muscles can help prevent pelvic organ prolapse, a condition in which one or more of the pelvic organs drop from their normal position and push against the walls of the vagina. We also know that pelvic floor muscles are part of the body's core muscle group. So, strengthening these muscles can improve our overall core stability and balance, which is beneficial for our overall physical health and fitness. So, how do we actually strengthen our pelvic floor muscles? One of the most important things we can do is Kegel exercises. So these exercises specifically target the muscles of the pelvic floor, helping to strengthen them. So Kegel exercises can help prevent or manage urinary incontinence as well as other pelvic floor issues if you do it consistently and correctly. These can also help improve sexual function. Another exercise which can help strengthen pelvic floor muscles is squatting. It's a functional exercise that engages the entire lower body, including the pelvic floor muscles. Deep squatting can be particularly beneficial for the pelvic floor as it encourages a natural downward movement of the diaphragm, which corresponds with lifting the pelvic floor. These are the two exercises that women who are going through perimenopause or are in their 40s can start doing to help their pelvic floor and their reproductive organs. Thank you so much for joining us, and we look forward to connecting with you again next week.